So whether you're watching this as a physio or a patient, this video is designed to help you get the most out of your active cycle of breathing technique. So if you're ready, let's dive in. Hey everyone, I'm Khalid. Welcome back to Clinical Physio. So the ACBT, or active cycle of breathing technique, is a set of different exercises that are used by patients every day all around the world. In this video, I'm going to take you through what the different stages are, give you some top tips to help you get the very best out of it, and then at the end of this video, I'm going to show you a full ACBT cycle in case you need to practice it at home. So as you can see here, the ACBT is made up of 3 key exercises repeated in a cycle. The first exercise is breathing control, normal breathing to try and encourage a relaxed breath in and out. The second is thoracic expansion exercises. These are deep breaths where we try and circulate as much air through the lungs as possible. And the third is a forced expiratory technique, also known as a huff, which is mainly used to try and get secretions up and out of the lungs. So before we break down the different stages of the cycle, why do we use ACBT? Well, there are a couple of different indications. The first is increased sputum retention, particularly for patients with a poor cough strength. The second is when we have reduced lung volume in our patients and we want to try and get as much air into the lungs as possible, particularly when it comes to atelectasis, when the alveoli, the very lowest end of the lungs, have been collapsed, perhaps when air hasn't got to those areas of the lungs for a long time. And the third is when patients have an increased work of breathing, and therefore that nice relaxed breathing control can be really useful here. So when wouldn't we do ACBT? Well, particularly for those patients who have difficulty following instructions, those who might be cognitively impaired, who might be really agitated or confused. But another consideration is for those asthmatic patients who are vulnerable to bronchospasm. So whilst the normal relaxed breathing control can be great for these patients, doing forced expiratory techniques can sometimes induce that bronchospasm, which can cause a lot of aggravation for those asthmatic patients. So just think about that one. Okay, on to the different exercises, starting first with breathing control. This is where we're going to try and establish a nice relaxed pattern of breathing for our patient, and therefore it makes sense that we want to try and get them in a nice relaxed position. So commonly this will be in an upright sitting position, perhaps with some pillows around them to try and make them as comfortable as possible. So from here, we ask the patient to put their hands on their tummy and then complete 5 normal relaxed breaths in through the nose and out through the mouth. There's no need to hold the breath in between. We're just looking for nice relaxed breathing. So why do we put the hands on the tummy? Well, this is for 2 reasons, effectively both of which focus on diaphragmatic breathing. Diaphragmatic breathing means that we're trying to use the lowest parts of our lungs to encourage a normal relaxed breath. And it's said that diaphragmatic breathing makes up 80% of our normal breathing pattern. The second reason is to try and discourage breathing from the most upper areas of the chest, because that encourages a faster, less normal breath. So as a result, as you're describing this to your patients, make sure that they've got their hands on their tummy to provide a little bit of sensory feedback so they know that they need to be expanding from the lowest parts of their lungs. So the second part is the thoracic expansion exercise, a series of deep breaths that we're doing here. So the therapist may put their hands around the outer ribs of the patient. However, if the patient is there by themselves, they can put their hands on their lateral ribs to achieve the same thing. Here we ask our patient to slowly breathe in through their nose, hold the breath for 3 seconds, and then breathe out through the mouth. The patient should be trying to feel for movement at the lowest part of the lungs where their hands are on their ribs to try and feel the ribs expanding outwards. So key tips here, first of all, make sure that the breaths are not forced and that we have a nice controlled, whilst being deep, breath in and out. And secondly, if your patient struggles to breathe out with a wide open mouth, they can produce the breath with pursed lips on the way out to try and make it easier for them. Now, the key aim of our thoracic expansion exercise is to try and encourage collateral ventilation, getting air all through the different areas of the lungs, through all the different channels, in order to reduce atelectasis and to try and promote the movement and loosening of secretions getting ready for our cough. So the third exercise is an FET, a forced expiratory technique, more commonly known as a huff. As you can imagine from the word expiratory, this focuses on the breath out, and the aim is to try and get secretions which may have been loosened through the first two exercises up and out of the chest. So the key things that you'll hear and see time and time again with a huff is imagining that you're trying to steam up your glasses. We're looking for a really nice wide open mouth, and the breath is aiming to come right from the back of the throat so that we're trying to get as much force into the breath as possible. So quite simply, we breathe in through the nose, hold it for a second, and then we produce that forceful, sharp huff breath out in order to try and get those secretions up and out of the lungs. So our goal is to get through 1 to 2 whole cycles without coughing, instead leaving the cough to the very end. And we often encourage patients to practice this for a good 5 to 10 minutes at the very least twice a day. But perhaps if the patient is more chesty, completing this every hour is good practice. So to start with, we have our breathing control. Our patient's hands are on their stomach to try and encourage that diaphragmatic breathing. And we will complete 5 relaxed breaths, in through the nose and out through the mouth. Next, we will go to our thoracic expansion exercises. Hands on the outer ribs to encourage maximum expansion. We complete a long breath in through the nose, hold for 3 seconds, and out through the mouth. We then repeat our breathing control. Hands on the stomach, 5 relaxed breaths, in through the nose and out through the mouth. We then repeat our thoracic expansion exercises. Hands on the outer ribs, long breath in through the nose, hold for 3 seconds, and breathe out through the mouth. We then repeat our breathing control. Hands on the stomach, 5 relaxed breaths, in through the nose and out through the mouth. We then perform 2 huffs or forced expiratory techniques. Long breath in, wide open mouth, and imagine you are steaming up your glasses with a breath right from the back of the throat. Finally, we will try a couple of coughs to try and see if we can remove any secretions that have been loosened. So I really hope you've enjoyed this video. If you have, please support us by hitting that like button and subscribe to our channel for all our best updates. My name's Khalid. We'll see you really soon here on Clinical Physio.